Senator Judd Gregg, Republican from New Hampshire, former Commerce Secretary, pick, in fact, for the president himself before the senator withdrew from consideration. He is not a fan of the plans he sees coming out of Congress right now. He's made that very clear in a series of different op-eds. He is, however, a co-sponsor of Wyden Bennett, one bipartisan proposal coming out of the Senate, although it's not coming out of the key location, which would be out of Senator Max Baucus's office in that gang of six. Senator Gregg, welcome to the conversation. Tell us, if you could, your thoughts, particularly on the co-op versus public option conversation that has sparked up over the weekend.
Well, I do think the White House has changed their position. It's sort of disingenuous for them not to say they're not. They started out as very strongly committed to a public option, which is understandable because the president himself said he was for a single-payer system. Now, what does that mean, those terms, public option, single-payer? They basically mean that the government sets the price and the government sets the care standards. And when you get into that type of a system, you're getting into a system like they have in Canada or in England, where basically certain procedures are rationed. They're delayed. If you reach a certain age, you don't qualify for certain procedures. And prices are controlled, and therefore innovation is stifled, and new drugs don't come online. You don't see those countries producing a lot of new drugs.
Doesn't that sort of rationing already exist?
Well,
now it's at the health insurance company level. In other words, we ration health care at this point. Basically, if you can't pay for it and the health insurance company pay for it, you don't get it.
Well, not really in that broad a sense. There is obviously some limitation on spending under any system. But the question is, when you put the government in charge of limiting spending, what you immediately have is a significant bureaucratization of the system, and you end up with a government bureaucrat between you and your doctor. You end up with a government bureaucrat basically deciding which drugs will be developed and which won't.
Right. What of those who say that we have insurance bureaucrats between me and my doctor now?
Well, then you can change the company if you don't like it.
That's not entirely true. I can't actually change my health insurance company if I don't like it in many cases, and frequently I can't even afford to get it, right? That's why we're having this conversation.
Well, actually, no. We're having this conversation because there are 47 million people in this country who don't have insurance, who we want to figure out how to get insurance. That 47 million is not a homogeneous group. 20 million of those people earn more than $75,000. And between the ages of 25 and 45 and simply opt not to insure themselves. Right. And if they fall off their motorcycle and get seriously injured, or if they have an unfortunate disease situation, then the rest of us pick up their costs. And what we're trying to do is figure out a way to spread the burden of insuring those folks without dramatically increasing the cost of health care for everyone else, and without forcing people off their own insurance plan.
I understand. We also spend 17% of our GDP, which is more than anybody else spends, and have a variety. Listen, it goes on and on. Let's talk about the bill you are co-sponsoring, Senator, and the Republicans' role in this conversation. First off, why did you decide to co-sign Wyden Bennett? What did you like about it relative to everything else you saw?
It uses the private sector to drive the policy that will basically move towards resolution and control costs and expand coverage. Under the Wyden bill, everybody gets a type of coverage. Even people who can't afford it today will be able to obtain coverage through a subsidy. Under the bill, basically, we say that we're going to control out-year costs by basically increasing the incentive for people to be healthier consumers of health care, focusing on diseases which are driving health care, and basically creating an atmosphere where there's competition for people relative to their insurance and giving them different options. You know, everybody doesn't need one-size-fits-all insurance.
Last question, the same one we asked Senator Grassley yesterday, and you're in even a more interesting situation, or I guess both of you are in different ways. What can you do, or what are you willing to do if you see a health care plan come out of the Senate that basically has the characteristics that you would want, that gives you what you would aspire to, but you do not have Republican support for it? How do you bridge that gap? What can you do as a Republican with someone like Ron Wyden, who's a Democrat, to bring perhaps less flexible or more dogmatic members of your own party into this conversation and away from sort of scare tactics and whatnot?
Well, I think the real question is, if there is a bipartisan bill that comes out of the Senate, and there may well be, because the Baucus-Grassley group is working hard. You've got the Wyden-Bennett bill, as you mentioned, which is bipartisan. How do you preserve the bipartisan elements of that bill when you go to a conference with the House and you've got people like Speaker Pelosi who are absolutely committed to having the government take over the system? And that, I think, is the big hurdle here. In other words, why would people sign on to a bill in the Senate if they know that the Speaker of the House and the President's people are going to torpedo that bill and move towards a government plan when it gets in the conference? And so unless the President comes out and says he's for the bipartisan bill as it leaves the Senate, and he's going to stand by that bill as it goes to conference, I don't think you're going to get a bill here.
Anything that you think you or other Republicans, Senator Grassley, others that are in the conversation, either in the room with Max Baucus or in the room in the conversations that you are having with other Republicans on a bipartisan level to elevate this to a more constructive place?
Well, I think we have. I mean, basically, I've signed on to a bipartisan bill, which is a comprehensive bill. I have my own proposal, which is, I believe, a reasonable proposal. There are a couple of other proposals out there that I could support. The Coburn-Burr bill I could support. So I'm perfectly happy and very open to a variety of approaches here, and not approaching it with a dogmatic attitude. But the problem is the House of Representatives, under the leadership of Speaker Pelosi, and at least the people who are speaking now for the President are being open, but there's other folks down there who are basically saying, no, we want a single-payer system under any scenario.
Senator Gregg, thank you so much for taking the time to talk to us on the phone this morning. Appreciate it.
Thank you.